Your process for vigilance is something you should set up correctly in every detail. At least that's my experience. The templates that we will look at were audited quite meticulously in the early summer of 2022 in an audit with our competent authority here in Berlin. So fortunately for you, there's some audit experience we can build on. A lot you can simply copy paste, and very little need for customization when you do that. In this video, I will only explain a bit better what needs to be done in this process and point you to the few aspects you will need to customize for your organization. And as always, starting out with the regulatory context, there you will actually find very little mentioned on vigilance in the ISO 13485 norm. Paragraph 8.2.3 only requires you to set up a process for the reporting of adverse events or advisory notices to regulatory authorities, as well as for keeping and maintaining records on that. You will find most of the regulatory requirements on this topic directly in the European MDR, specifically in Chapter 7, Section 2, Articles 87, 88, 89, and so on and so on. We will not go through those in detail now. It's simply too much text. But as you can imagine by now, your general obligation as a manufacturer is to identify potential threats resulting from the use of your medical device and to take appropriate actions on that. Now, let's already close that chapter of regulatory theory, and let's take a close look at the process steps you will need to follow in order to comply with those requirements. Our SOP starts with a few general definitions of terms that are actually very important in that context. And we've directly copied those from regulation and guidance documents. So in your best interest, don't change anything here at best. The most basic thing to understand here is whenever you have issues with a device in use on the market, those issues can be classified as incidents, but only serious incidents have to be reported to authorities. And we will later take a look at how you can tell apart serious incidents from regular incidents. You can document that in a separate template on incident assessment. For now, you only have to reference that template, or if you use it, that template in your QMS with its document ID here in this first paragraph. Next on, here you can find the official definition of a serious incident as defined in the European MDR. So that also includes malfunction or deterioration, inadequacies, but the difference here, I guess, is that the consequences that it directly or indirectly might have led or might lead to death of a patient, use or third person, or to a serious deterioration in the state of health. If you work with this for a while, that's actually a definition you will start to memorize quite quickly. For everybody reading that for the first time, we've also added some examples here we've collected from guidance documents. You can have a look at this on your own in more detail. We will move on to field safety corrective action. Now, whenever you initiate actions to remedy the effects of a serious incident, those are called field safety corrective action, or FSCA. You always have to report FSCAs to authorities. And let's stop here for a second and think about this for a moment, because I've already heard from auditors and others that especially startup companies oftentimes perform field safety corrective actions without even being aware of it. Let's say, for example, you only have 2 or 3 early adopting customers in the beginning and something happens with your device. The bar is then quite low to just pick up the phone and tell customers not to use your software for a few hours until you have fixed the bug. And that might already classify as field safety corrective actions, both fixing the bug and informing the users about your recommended course of action. Next on in this next section, those are more formalities, but nevertheless important. There's some very strict reporting timelines for serious incidents. And I don't think the exact differentiation here is actually too important to know by heart. The bottom line is everything has to be done immediately at best. And so nothing else should take priority if you think you're facing a very serious incident. And you have to have very good reasons for any delay in your reaction to it in case that happens. The next section here simply mentions the contact details for relevant competent authorities. And that is one paragraph that you should actually customize. So mention the government authorities that are relevant to you and in the countries that your device is marketed in, and remove the ones that are not. So those are simply examples we've put down here. And with that, we've finally reached the actual process steps already. And without much surprise, we will start this process by documenting the incident. We recommend using your existing Kappa process for that, just because why setting up something new if you can use what you already have? But of course, you can choose any documentation format that you want. You can also set up a separate new one for that. 3 things are more important to point out here. First, anybody can report a potential incident. Most typically, this could actually be a person outside of your company, a user, a B2B sales customer, and your employees only become aware of it through your feedback channels. And that's why it's important to define here very broad input channels for feedback. Second, your person responsible for regulatory compliance, or PRC, is exclusively in charge of this process. So he or she should be strictly independent in the assessment of incidents, and especially independent from management influence. Third and last, your documentation efforts on this incident, potential incident, should never get in the way of immediate action where required. So during audits, we can also find that here. During audits, we've received some critical questions on this, as down here. So auditors were concerned if initiating the Kappa process here would not cause any undue delay for immediate action. But if you look into our template for the Kappa process, however, you will see that immediate action must be initiated always before any Kappa investigation is started. So if you use our template, and you should face those questions, that could be the answer to that. The next step is to investigate as if it was in fact your device that has caused the incident. But even if it was not your device, you may still need to take and initiate actions, simply to prevent something similar happening with your device. So in any case, whatever conclusion you take here, the process doesn't end here. Next, you document your entire incident assessment in the separate form that we've already talked about earlier. And again, we will take a look at that template right afterwards. One more thing is to be mentioned here, though. We already learned that only serious incidents and FSCAs have to be reported to authorities. There's actually a third aspect to this. The MDR introduced this new concept of trend reporting following Article 88. For instance, you might assume that a hazard or undesirable side effect occurs only once per year for your device. But now you're faced with 10 occurrences and it's only mid-March. So in that case, depending on your risk management data and statistical extrapolation, you might be required to report such a significant trend change as well. That's what's mentioned here for full compliance. But this entire topic is more related to risk management and especially post-market surveillance. So for more context, it might be helpful for you to watch those videos again. Next step here for now, you then finally send out a notification to state authorities and your notified body if required. And as said before, make sure to always keep records on that for audit trail purposes. Finally, we're almost through. You carry out those actions as planned. So if you have to inform users, that's actually an industry best practice here to also use a standard form on that, so-called field safety notice or FSN. And we will also take a look at our template for that purpose as well afterwards. In the last step, though, you should document a verification and effectiveness check of your implemented actions. And you should know already that requirement from your Kappa process. So we've already noticed there are two more templates associated with this process, one for incident assessment and one for the safety notifications to users, the so-called field safety notice. First, let's briefly walk through the incident assessment form. And this reflects exactly the steps we've just looked at in our SOP. So you give a high-level summary first. You then describe the incident, how it occurred. You assess if your device in fact was the cause of that incident, and you then assess if it meets the criteria for a serious incident that needs to be reported. One last general note on this template, however. Keep in mind that you should not only fill this out if you're convinced that you need to report something. As we've seen, incidents are defined rather broadly, and it could be equally important for you to document why an incident is not classified as serious and why it does not have to be reported. Last on the list, let's take a look at the field safety notice template. And this one really doesn't need much explaining. For starters, if you adopt this for your organization, you could already fill out the company name and potentially the product involved. And then this is, besides that, it's literally a suggestion of how you could address your customers and users if you inform them of an incident and recommended actions. The bottom part here is most important, however. Describe the workaround you suggest for users, announce a recall or a software log for your device before you perform it. Again, this is mostly industry best practice, but also auditors will be content to see that you are prepared for all eventualities. And that's it. Thanks.